All right, we are live. Okay, I'm going to start out with our introductions, and then we'll get in. Good afternoon, ladies and gentlemen. Good evening if you find yourself on the continent. Good morning for those of you all the way in Australia. My name is Sam Baddoo, founder and CEO of Fleri. Welcome to the sixth episode of the Fleri Care Digest. Today I am extremely excited to be able to introduce, a friend, a personal inspiration, but also an amazing founder who is building in a space that we don't see a lot when it comes to healthcare on the continent. Folake Owodunni, I'm going to let you introduce yourself because your accolades are endless, and we wouldn't be able to pick them up off the ground.
Wow.
You
Wow.
know,
Very
co-founder
flattering, Sam.
CEO of Emergency Response Africa, literally saving lives by the second. Folake, welcome to the Fleri Care Digest.
Yeah, thank you. Thank you so much for having me. Fleri team, I love you guys so much. I think you're doing something hugely important, and I'm really proud to be both a customer and a partner with Fleri. So, as you've said, I'm Folake Owodunni. I'm the co-founder and CEO of Emergency Response Africa, and we are a health tech company. And as our name somewhat unimaginatively suggests, we provide emergency services. The way that I like to describe it, especially for those in the States, is like, or in North America, is like a 911 style service for Africa. And I always love to share, what inspired it. It came from an experience that I had having to call 911 for one of my children, and just being so blown away by the level of service and how quickly we got help, and the fact that, what would have been a very difficult, maybe traumatic situation, if it had happened in Nigeria, turned out to be something that was resolved within minutes, and my family was fine. And so for us at Emergency Response Africa, the whole objective is to make sure that people across the continent, starting in Nigeria, can get the help they need as quickly as possible at the scene. And then if they need to get to the hospital, we can convey them to the hospital while they receive treatment on the way. I don't believe that we should have the level of death that we have, preventable death. If you look at Nigeria specifically, and I geek out on this stuff, so I'll share one stat. If you look at Nigeria specifically, every single year, 1.2 million people die in circumstances that could have been prevented by timely emergency response. That is a huge number, and it just tells me that this is one thing we can do that would make such a difference in our lives and in the lives of our loved ones. So super happy to be here having this conversation. Thanks, Sam.
Thank you so much. I could not have introduced ERA any better. But before we dive into the service and the work itself, you have a very corporate background.
Hmm.
You didn't go to medical school.
I did not know.
And I've always wondered what causes someone to leave, PwC? What causes someone to leave, numbers and slides to go focus on, not just the headache that emergency medical services are, right? But to actually go focus on emergency response care in Nigeria, right? All you have to do is just like get into Lagos, and the entire scene feels like an emergency in humanity.
Chaos. Yeah.
What's that background and how did you end up here?
Yeah, good question. So, I guess the interesting thing is really from childhood, I always wanted to help people. I'm doing air quotes so you can see them. And sort of typical African upbringing, right? How do you learn what is a career path for someone who wants to help people? It's medicine. And so I actually was pre-med in undergrad, did all the courses, thought I was going to go to medical school and become a doctor. And then I had, maybe I should call it an early life crisis, not a midlife crisis. where, I realized that I wanted to help people, but I didn't want the one on one sort of clinical interactions that I saw I would have if I went on with my plans to be a medical practitioner. And so I kind of stepped away from that plan and eventually discovered public health, which is what I went on to study. But as life would have it, you even though you study one thing, your career sort of takes you in different paths. And I ended up doing some work in like marketing communications. I ended up working in consulting, like you mentioned. I found all of it really interesting. Funny enough, consulting was one I loved that experience. Like I wish I had done it longer because I feel like you learn so much from it. But coming out of that, I knew that my fundamental desire to help people at scale had not changed. And so one of the things that I did was I eventually did a second master's program. So apart from a master's in public health, I then did a business entrepreneurship and technology program. And I think that was what really opened my eyes to the fact that I can help people. I can use what I've learned in public health, but I can put it in the context of entrepreneurship and do something that is impactful. And I think it's, all of those things that combined to what we have today.
So for those of you, who think that, just because we start out where we are today means
Hmm.
that we have to end up there, it's not necessarily the truth, is what you're kind of saying. But how much did your public health background, and how much did your business experience prepare you for not just, solving a problem? Because that's one thing, but
Hmm.
rallying up a team
Mm.
and building a team that can align on solving something as challenging as what you are trying to do today, bringing emergency response services to people.
Yeah. So I think the public health side was incredibly helpful when it came to understanding the problem and ideating on possible solutions and sort of assessing each of those possibilities. In many ways, what I did in public health was a lot of research, analysis, putting together programs, monitoring and evaluation. And you need those things to run something like what we're doing at Emergency Response Africa. So I think from that perspective, it was really, really helpful. And it certainly, helped me to also think about things like unintended consequences. For every good you want to do, there's going to be risks, there's going to be challenges. How do you mitigate those risks? So I think that was really helpful from that perspective. Where the business sort of background, and I wouldn't even say just business, I think, some of my different like professional experiences came in, is how do you, what makes a great team? How do you identify people that are passionate about your specific cause, but also about their work in general? And how do you pull those people together? How do you identify when, maybe things aren't working as well as they should and when you should change course? And I think those particular skills came from, the business studies as well as the professional work experiences. So I think, yeah, it's the diversity of my experiences and background have been really helpful. All the slides that I put together, in my consulting days, especially as the grunt worker of the team, as a founder, you're constantly putting together presentations, whether you're pitching to an investor or you're trying to make a sale, like you're always doing something, right? So all of that's been really helpful. And I think nothing's wasted. That's the way I look at career paths.
Mhm, mhm. That's really insightful to look at it from that standpoint. Now, I'll get back to ERA, but yesterday I was reminded of a story. I was talking to this lady, Auntie Peggy, in Ghana, and she runs an elderly care service for aged folks. And she was telling me about, the situation with a gentleman who was being transported from the US actually to Ghana. And the unique situation was this person, I think, had started to get ill, had some mental illness. And she was describing how they bundled, the gentleman, to be able to get him to a hospital. And I didn't really think much of it when she told me the story, but as I thought about our conversation, prior, it occurred to me that we usually think of emergency response as the thing that you do when there's an accident or when someone passes away, right? But we don't think of it in terms of how do you handle human beings who are facing medical crisis due to mental illness, right? This is the US. A lot of us or a lot of people have responded to mental illness, by ending up shooting the person that was mentally ill.
Mm-hmm.
Think of how many people have had a cousin, a brother who was having a meltdown,
Yeah.
a psychiatric breakdown. How do we even transport that person? How do we calm them down? And these are the things that you are teaching. First aid. Shamefully enough, if you think about it, when was the last time I took a CPR class? Right?
You can change that, Sam.
It's been a while, right? Being
Yep.
being in the military, you learn to use a tourniquet, you learn to use, give CPR, to do
Yep.
all of that.
Yep.
But what if I wasn't?
Yep.
What would happen in that way? And so I want you to talk about, you know, one, what is the scope of emergency response services, right?
Mhm.
That ERA is actually bringing to people. And then two, what is the outcome, right?
Mhm.
The world that you're trying to create, right, with the work that you're doing. That would allow us to kind of dive into some of these preconceived notions that we think emergency response services are, for people to understand the breadth of the work that you're actually doing.
Yeah. Yeah. Good question. I'm trying to take notes so that I can hopefully address, everything. So I'll do my best. Yeah, you make such good points. I mean, at the end of the day, most of the time when we think of emergency services, right, the first thing that comes to mind is ambulance, right? And the second thing is, transporting dead bodies. Most of the time, we equate those two. An ambulance is for transporting dead bodies, which it is not, right? It's meant for the living, but because of our environment, because of what we've been used to, that's what we think. Now, one thing that's been really, really fascinating for me is actually to study the history of emergency services in different parts of the world. And the best part about learning all of that for me has been to realize that it's actually always followed a certain pattern or a certain trajectory. It started off with the first responders being, for example, the police or some, fire services or some other people. And then the society realizing that actually this is not an adequate response and we need people who can come and demonstrate care. And so then they start with, okay, well, maybe, we need to be able to pick people up. But because, timeliness and all of that is really not in the works, so it ends up becoming more of a mortuary service, right? The person who drives the van picks up the body and takes them. And then over time, as people start to realize that we can do so much more, it actually starts to evolve into ambulance services, which is patient evacuation. So picking from, one hospital and taking them to another hospital. And then some more time, it starts to evolve into proper emergency medical services, where you're now talking about pre-hospital care. So a person who is having an emergency, either on the road, at home, at work, wherever, they're able to get care at the scene of the emergency, maybe even be discharged then and there, as was my case with my son. Or, if they require additional care, they can be put in the ambulance and then they can be taken to a hospital. And so I think for me, it's been really encouraging to see that really globally, most emergency services have followed that trajectory. And where we're at right now in Nigeria and more broadly in Africa is really at that stage of, people are carrying dead bodies into hospital, patient transfers are happening, but we've not quite gotten to the point of true emergency medical services. And I think what we do at Emergency Response Africa is we're trying to move us and shift us to that point of understanding what it is when we say EMS, and actually being able to deliver it. So for clarity, for those that are listening, when we say emergency services, it's not just about the ambulance. Um, in many cases, a lot of people will say they have an ambulance, but it turns out it's really just a bus with a bed and, maybe a few things in there. That's not an ambulance, right? Like there's so much more to it. So when we say emergency medical services, we're really talking about the delivery of pre-hospital care and patient transportation so that advanced care can be received at the hospital. And so for us, what that looks like and how that's influenced our model is that we really emphasize on having first responders who are trained, qualified, certified individuals with a paramedic background that can come to the scene and start care at the scene. So if the person, and you know what, maybe I shouldn't speak hypothetically. Let me give a real world example. Sometime last year, we had a call from an office. I think it was like an office in Yaba. And Yaba is in Lagos, for those who may or may not know. And they said, listen, my colleague fainted, right? Somebody just like passed out. And of course, everybody's panicking. They don't know what to do. And so what we did is kind of the three stages of response we provide. Number one, when you call us, you're speaking to a medical dispatcher. So this is a person who's also a paramedic. They understand what happens in the field and they can triage, they can provide support. So immediately the person is, providing some instructions, things like elevating the legs, check this, check that, things that any lay person who is willing can actually do. And while that's happening, they then dispatched a first responder on a motorcycle who could get to the scene of the emergency and begin to treat. And so that person got there, they were actually able to revive the patient, get them, sort of aware of their surroundings and all of that. And then eventually the ambulance arrived. And I like to say, eventually, because the truth is, like you said at the beginning, when you talk about a place like Lagos, I mean, the fact is the roads can be hectic. It can be difficult to get, a full-on four-wheeled vehicle to a particular situation just by virtue of traffic or bad roads. You really don't know what could happen. And so for us, having that tiered response is really, really valuable because it means that from the moment a case is reported, something can be done. And by the time the ambulance arrives to pick up the patient, they should already be stabilized because work has already been done. And so if we now have to transport them to the hospital, they're going in good condition or better condition than if we do the typical Nigerian thing, which is, okay, we'll bring the car, carry them, shove them in the back of the car and then start driving. And then you get to hospital A and they say, oh, we can't help you. Go to hospital B and C and D. And eventually the person loses their life over something that they really didn't need to. So just to say, like, that is what emergency medical services looks like. To your point about mental health, and I do want to respond to that because I think it's really important. We've had multiple situations that we've had to respond to mental health crises, including intervening with someone who's attempting to commit suicide, someone who really has sort of lost all awareness of where they are and who they are and what they need to do. So we've had to respond to those. And as a part of that experience, we're actually currently working on developing a mental health first aid course that we can deliver to as many people as possible. One of the things about most of the medics is they may not have been trained specifically to deal with mental health crises, and that again is the nature of our environment, but they've been trained to care. And for us as a company, empathy is one of our core values. It's something that we don't want to just talk about. It's something we want to demonstrate. And when you get into those kinds of circumstances, one of the biggest things that you can have is empathy. You can be firm, you can be clear as a medical provider, but you can still demonstrate empathy. And that has translated into cases where we've had to transport someone who's experiencing a mental health crisis in our ambulance to a psychiatric hospital. So it does happen, and we're proactively trying to get ahead of that because we will see more and more of it. But that's really what emergency services is about, that pre-hospital care.
Yeah. I really appreciate the breakdown, and you touched on a number of things, right? You talked about, and I'm going to get back to my second question because I know that by now you've forgotten about that, but we
Totally.
will
Oh
address.
yeah, the outcome. Yeah. Okay.
So you talked about the fact that when someone actually calls ERA, the first thing they get is a medical dispatcher, right? Which is important in other cells. Number two is the fact that the first responder, right, is a paramedic who is on a motorcycle. Now, I want to dig into that because it's probably the question that we get asked a lot at
Mm,
Fleri about your services. If you look at the way that we usually go about healthcare on the continent as an African people, we like big, flashy things, right? It's the reason why instead of building smaller, primary care facilities,
yeah.
we build large, you know, surgical and all
Yep.
sorts of
Yep.
specialist
Ed specialist hospitals. Yep.
because we can spend tons of money and do sword cutting and cut ribbons, all day long. And a lot of people tend to like carry all of these, remnants of the way that we think and apply it to everything. One of the reasons why we are so excited about the work that ERA does is this localized knowledge that carries through everything that you do. One, the ability for you to address people in their local languages, right?
Hmm.
Rather than this, um, presumably professional English only setting in that way.
Hmm.
Number two, it's the fact that understanding that speed to care is so important in an emergency. You use motorcycles rather than spending so much money buying 500 ambulances that would just sit there and waiting. And when they are dispatched, they can't actually even get to the person
Hmm.
because
Hmm.
we've seen it, right? It can't get to the person. And I really wanted to emphasize that because I think it matters that we create solutions that cater to the places where we are,
Totally.
right? In the way that we build for our own people. And I really, really appreciate that about the way that you work. And on to my second question. What is the world that ERA is trying to create? What are the outcomes that you want to see? If 5 years from now, right, we're sitting here counting your billions, right? What,
Amen. Oh,
what would it be that
yeah.
you want to have created?
Yeah. So, I'll start with our vision. Our vision is for an Africa where anyone, regardless of who they are or where they are, can get help, emergency help, in 10 minutes or less. That's the vision. And when you think of the expanse that is Africa and the population that is Africa, that is huge. I mean, we're not just talking about the Lagoses and Nairobis. We're talking about, the rural areas, far, far away somewhere where, it is difficult to get to. I'm not even talking about get care to, right? So that is our vision. And our belief is that to achieve that, like you rightly just said, we have to have local solutions that are tailored to what makes sense. So having that community-based first responder model is going to be key to achieving that vision. What are some of the outcomes that we want to see? I think the biggest one, most fundamentally, is a reduction in the number of preventable deaths. So I gave a number before, 1.2 million, and that's based on a statistic that says 54% of all of the deaths that happen in developing economies could be prevented by timely emergency response. That is a huge number. When we think about the level of impact of healthcare innovations or healthcare solutions, that is a really high level of impact. And I remember there was some paper that put that on par or close to par with things like immunizations that are being given at a very young age. So it's such a big potential solution to a lot of challenges that we face. And I'm not just talking medical, right? Like think about it. When someone suddenly dies because they've gone through an emergency, right? We often frequently will talk about the healthcare bills, right? Catastrophic financial, impact of that. But we sometimes forget that if the person just like dies, right? If they're a breadwinner, suddenly you have a family that's put into poverty, right? And the outcome of that could be generational. So I think for us, yes, we're talking about medical emergencies, we're talking about saving lives, but we fully recognize that the longer term outcomes of being able to achieve our vision is so much more than that. It's essentially socioeconomic. So, I am hopeful, I'm excited about the vision that we're working towards. I think the big thing is really, especially on platforms like this, getting people who have the understanding, who have the know-how and the means to invest in such solutions. And by invest, I mean pay for them, pay for them for yourselves, pay for them for your family members. That is really the starting point, because that's what then gives us the open door to find other ways to provide it for those who maybe can't pay in the future, right? So anyway, that's the vision. That's really what we're working towards. You're muted.
Yeah, that has to happen at least once.
Yeah.
It is so exciting, right, to hear um, Africans propose solutions, sacrifice the follow through in order to see those solutions become possible for our people. Right? We often dream, we often talk, we often discuss in so many forums, WhatsApp groups, clubhouses, Twitter spaces. It's very rare to be able to see the actions that back those things up in a way that translates into a better quality of life for the average African, right? And if we had magic checks, right, we would make that possible. But I guess the price that you pay for it is longer work, heartache, and all of that. But I appreciate you sharing that. I wanted to get into the dynamics of the business itself and the experience that people get. So when you think of ERA, we just talked about someone who called from an office in Yaba, right? How do people experience ERA? Do they go onto a website? Is there an emergency phone number? Is there an app that they can use? Please talk through how someone who's watching us today, right, who wants to be able to use ERA, how do they use it?
Yeah, absolutely. So before I answer that question directly, what I'll say is, obviously we're on Fleri Care Digest, and we have plans on Fleri. So what that means, like the first point is really just to have a plan, right? So, go on the Fleri website, learn a little bit more, contact us if you have questions, but actually get a plan. Now, once you have a plan, what that does is then it opens the door for you to be able to use the service whenever you need it. And what that looks like, practically speaking, is that you can access us 24/7 in two ways. So, way one is through a toll free emergency helpline. What I really appreciate about having a toll free line is the fact that you can't predict emergencies, right? You never know when or where it's going to happen. You don't know if it's going to happen in a situation where you really, don't necessarily have access to calling credit. And I'm talking about within the Nigerian context, right? So anybody can dial that number, anybody can dial and get through. You don't have to have like airtime on your phone. And that is live 24/7. You get connected directly to a medical dispatcher. The second way that people can reach us is through our mobile app called the Signal by Era app. So it's available on the Google Play Store. It's available on the App Store for iOS users. And what that essentially is once you're in there, you are able to submit a request with just a few clicks of a button, and that request immediately goes to our command center, right? Again, straight to the medical dispatchers. And what you'll find is that they're going to call you in less than a minute and work with you through whatever the situation is. And we recognize that sometimes there are emergencies where maybe you cannot speak, and that option also exists, and you'll see that within the app. So it allows you to give us a picture of what's going on within a few seconds, and we start to address the situation. Once you've submitted your request, whether on the phone or on the app, we will basically work with you throughout the entire process. So when your responder is on the way to you, you're going to get live updates. Okay, this is the ETA, this is when they're arriving, this is who your responder is. When they're there, we just want to make sure that things are okay. When you are transported to hospital, we will actually communicate in advance with the hospital if it's one of the ones that we already work with. And the real benefit there is that, sometimes the biggest delays actually happen at the hospital level. So even if you do all the hard work of getting in a vehicle and you're, making your way, when you get to the hospital, depending on who you meet and whether they're having a good or a bad day, sometimes things don't always go smoothly. And so we try to minimize or eliminate those delays by communicating with them in advance so that they have all of the details of the case that's coming in and they can respond within a couple of minutes of arrival. So that's really the experience that we strive to give. And that's the thing that people most comment on. It's like, in spite of all that, especially a place like Lagos can be, the fact that there's someone with me throughout the process supporting and responding is really valuable.
Is there a reason why, like in all of the campaigns that we've had for the elections, we'll talk about that later. Nobody has pitched, that they've gotten Folake on their advisory team. I mean,
I've been begging them to bring me, but I'm kidding. I don't
what's
know.
like someone who should be giving you the whole Lagos emergency service to
Wouldn't
run?
that be nice? Wouldn't that be nice? I will say this. I just did an article, an opinion piece in one of the newspapers this week, Premium Times. And for me, it was really about, regardless of who comes in to power this weekend, my hope is that they will keep the value of life in mind and ensure that things like access to emergency care can be available to everyone. Like, yes, there's a lot of, political things that are happening, and, we could spend forever on that. But I think for me, Nigeria, we deserve better. We really, really do. And so, whoever comes in, my hope, my singular hope, is that it's something that they prioritize and it's something that we'll be actively advocating for.
Yeah, yeah. Makes sense. Thanks a lot for walking through the experience, right? I'm going to jump in a little bit into Signal itself
Okay.
because, one, the service is great. The service is amazing. We have folks who come through Fleri, right, living in the UK, living in the US, who want their family members to have access to Emergency Response Africa because it gives them peace of mind, right? In addition to whatever other plan they're getting, they do that. But let's talk about this amazing innovation that is Signal,
Hmm.
right? I live in the US. Wherever I am in the US, if I call 911 on my phone, I don't even need call credits, right?
Yeah.
It will connect me to and route me to the local emergency service for wherever in America I am in that particular time.
Hmm.
Signal mimics that, right, by giving you a single button action to be able to triage your emergency at the time when you're having it. And it's insane. So I want you to spend a few minutes talking about this experience that Nigerians are having access to, which creates a possibility for everyone to be able to do that.
Yeah, so maybe what I'll do is I'll first talk about what happens currently, right? And it was perfectly illustrated by a lady. I wish I could remember her name. I think it's Tanya Motayo. I think, she's an influencer, or, on Inside. Actually, I don't know what she does, to be honest, but I think she's an influencer on Instagram. And I came across a post sometime last year where she literally said, Nigeria will humble you, and then she went on to talk about having to call either 6 or 9 or 16. I can't remember the exact number, but some insane number. I think it was like, yeah, 16 or 19 hospitals in order to find one ambulance. And eventually, she found the one ambulance, and was able to get her situation sorted about an hour and a half after she started. And, seeing that, I was just like, this is such validation for what we're trying to achieve, which is when you have an emergency, what you don't need is to be trying to find, the 100 different numbers to call to see if you can happen upon one person that can help you. What you do need is a single number to call or a single place to go that everything else will be taken care of. Whether that's, the initial care over the line or the ambulance itself, or even down to which hospital do I go to? Because we also know that it's not every hospital that will help you. If you have a brain injury and you go to a primary healthcare clinic, there's not a whole lot that they can do for you, right? So I think from that perspective, that is the way in which we have attempted to mimic what 911 does, right? 911 eliminates the need for you to know multiple providers, try to figure out which one is available. No, we want you to be able to say, all right, Emergency Response Africa, ERA is my provider. This is the number. I have it saved. I even had to send it to my family members because, believe it or not, our sort of, apathetic attitude towards these things is such that, hey, is it not you that is doing emergency? That's how we think, that's how we do. But the goal, right, is for all of us to have that one place to go, that if you reach out, we will do all of the work of finding the provider that's close to you and dispatching them and really just walking with you throughout the journey up until you get to a point where you're receiving hospital care. In an ideal state, where I hope that Nigeria will go, we have our own toll-free number. If I call the number out here, everybody will be like, that number is too long. Because it is, right? It is a long number. There are some regulatory requirements around being able to have a short code like 911. My hope is that the time will come where, the NCC line, so the Nigerian Communication Commission line, I think it's like 112, can be a hub where providers like us can plug into and essentially work. If you think about what 911 is and what, many of these emergency numbers are globally, they're the front, and then on the back end are providers like us. And that allows everybody to win, because from the public's point of view, they only have one place to go. From our point of view, we have one source of all the emergency cases, and we can do our jobs, which is to fulfill. So the hope is that we will get there. Like I said, post elections, we see who comes in, and we will advocate for that. But in the meantime, we keep pushing on the private side. Muted again.
Yeah, I really appreciate you walking through that, right? And for those who are listening, I think Maxwell, Olufemi, Dolapo, they're all saying, as when you hear it for the first time, you're like, okay, this is different, right? But when you actually know that it works and it's real and it's not some proposal for something that could work, all you start thinking is, what is the potential of this if we can actually realize it, right? How much more lives could we save if every person in the village, right, could be able to secure this? And, as you talked about it reminds me of our own experience at Fleri, and part of the reason why we ended up, moving to work with ERA. About a year into the work, I remember getting a call from a lady who was in Abuja. She called, "Hey, Mr. Sam, my mom is not, my mom is having trouble breathing." And I was like, "Okay, have you called your CS team, the customer support line?" She said, "Yes, I've called them, but they said they're looking for an ambulance. They haven't gotten back to me." Right. And we were working with a provider at that time, who also, like most people, have outsourced, all of their emergency service to hospitals that have ambulances. But what you're not aware of is that ambulances in Nigeria or hospitals in Nigeria pick and choose which emergency cases they want to respond to based on the likelihood that the person is not going to die. It's the most insane, thing to think about, because we're given the mandate to protect life,
Mm-hmm.
but we're so focused on, what are the outcomes even before we respond.
Yeah.
And after 45 minutes, and at that point in time, it was 7 p.m. Eastern time. I was getting ready to head to Michigan, right? I couldn't even go. 7 p.m., I start calling everybody that I know in Abuja, in addition to the provider, and Googling. And I'm on my work phone. This lady is speaking to me on WhatsApp on my personal line, and she is frantic because she is panicking. That's her mom, and she has three little children. She can't even take her mom. She can't carry her mom, right? Because she was getting home care at that time.
Mhm.
And that experience, we finally get a hold of one ambulance somewhere in Abuja. I call, and the operator, the actual dispatcher says, the ambulance driver has gone to eat. I can't get a hold of him. Here's the number. Call him and see if we can convince him to go pick this person up. I call the ambulance driver, ask him to go get his vehicle and go to this place. And he's trying to ask me, how much are you going to pay me, Oga? Now, who talk say, make you call me? Look at all these questions.
Yeah.
Go get the oxygen. Make sure that you take oxygen. After 45 minutes, get in an ambulance. This guy gets there in the rain and tells me, Oga, I forgot the oxygen.
Yeah. Yeah.
As I think about it, this scenario, the lady ended up passing away.
Yeah.
It put me in depression for months, right? I just could not understand what I had gotten myself into. Because why do we want to make change? And it's like it's so difficult to be able to get that to happen, right? And as you speak about the work that you're doing and being able to decentralize and take over this dispatch, right? I constantly keep that in mind and in prayers that so many underutilized resources, there's so many private people who own ambulances, and the ability to connect all of them to the work that ERA is doing and be able to dispatch them and give them all of that latent opportunity is such a huge one for us that I cannot say enough, right? Just how important the work that you're doing and how important it is that we can support it in any way that we can, right? For people to be able to get the care that they need.
Can I, yeah, I just want to say, like, I mean, I remember that story, I remember that incident, and I remember just being so pained and so heartbroken, especially because of some of the other circumstances around it. The truth is, like, this is stuff that we have to deal with as well. By very nature of, again, the environment, there are those circumstances where people don't take this as seriously as we do. And I think that's a big part of why we spend a lot of time assessing the partners that we work with. If anybody gives any indication or of being less than willing to value life in the same way that we value life, we do not work with them. And it's just, there's a lot of risk in this environment. That's actually the truth of it. I also don't think it would be fair or reasonable to say that oh, everything is going to automatically change, and for example, we are the ones to transform it. No, I think it's going to take time to be, I don't know if fair is the right word, but to give some leeway or some support to the hospitals themselves who own these ambulances. We also have to keep in mind the environment that they are operating in. When you're operating in an environment where people are not largely covered by insurance, where people will frequently come in for care and not be able to pay, but you've provided care out of the goodness of your heart as a medical provider, it puts a lot of these hospitals in difficult financial circumstances. We have partners who've said, listen, we have an ambulance, but we've always been hesitant about bearing the full cost of having a driver full, for 24/7 and having the medics for 24/7. And we're like, well, we can't send an ambulance without a driver. We can't send an ambulance without a medic. Like, that's a bus. We might as well send them a bus or an Uber. So as much as I, struggle with some of the wrong things that people do, I also understand that our providers and partners are operating in a difficult environment. And I think that is where collaboration, mutual understanding, goal setting, also standard setting is important. And that's why for us, we will pick and choose. Like, is we just can't work with everybody. For some people, they don't actually care about the patient outcome. They just want the money. We're not interested in working with such people. We want those who will put the patient outcome first and trust that we will deal with the money and make sure that they get paid. So it's a tough, circumstance for everybody that's involved. And that's part of what makes the work we're doing so difficult. But again, like we said, we don't start things because it's easy. We don't start things because there are billions sort of waiting in the wings. We do it because we believe that we can actually make a change, and then maybe someday, the billions will come. But in
Yeah.
the meantime, yeah, we keep pushing.
Yeah, and I think this is a really good segue to kind of get into, the partnership with Fleri, right?
Mhm.
Um, I grew up in Ghana. Although if there's any other place that I'll pick, it will be being born in Lagos, Nigeria. Um, Growing up there, the same situation is what we see. Um, the biggest challenge that you've mentioned, right? And in fact, the biggest challenge to any healthcare provider who wants to do genuine work is affordability. How many people can afford the care that they get? When I started thinking about, Fleri, right, I wanted to understand why my circumstance was not any special, right? My grandmother had gotten sick. She was she had gone to a local polyclinic where she lived. She was given a prescription and she was given a referral to go to a hospital, a bigger hospital. She thought it made more sense as someone who had children and grandchildren abroad who were sending her money. She thought maybe it makes more sense to go see a local traditional healer, right? Because that would be cheaper for someone who really did not have to think about the component of cost. Think about those who can't even pick and choose between, I can get the money, but I'm just going to be, stubborn, right? Those who do not have the money at all, and all of the things that we're talking about, they go to a hospital because they are in pain. They genuinely can't afford to pay for it. Flurry's goal, with you and everyone else is over time to make it more sustainable to run a healthcare business in emerging countries in a way that actually allows you to be able to grow and earn a living. Flurry isn't going to make any healthcare provider a billionaire, but what Fleri will do is ensure that they run a sustainable business by connecting the people who are already sending money for folks to get access to care and giving those folks the temptation of having to pick between, that stomach ache and feeding their child or school fees or the funeral or at worst, the pastor who's asking for tithe, right? Fleri is supporting those folks to directly get the money into the healthcare system, right? And as I've heard from so many other providers, similar to you, it's can we bring in financing that allows us to cover this? So I wanted to talk about how you see the folks who are thinking and coming through. How should they think of ERA? What is the thing that should give them peace of mind as they look at, well, I don't know how my family in Port Harcourt or Lagos is doing, but if I entrust my money to ERA through Fleri, they will have care, especially because you live in Canada.
Yeah. Yeah, let me I'll put it in the context of the alternative, right? Um And many of us have been in this circumstance in one form or another. You are abroad, wherever abroad may be for you. So let's say UK, Canada, US, UAE, Australia, wherever, right? You're somewhere other than home. And you suddenly get a call, mommy is sick or daddy is sick or somebody is, they're not feeling well at all. We're thinking of rushing them to the hospital. Okay, you manage to do just that. And then, you get hit with a certain bill that is just like, from where? And worst case scenario, the sickness is so severe that you want to book a flight immediately. So you're going to spend a few $1,000s, realistically, maybe, in order to go and see what is happening and take charge in a sense. That is a lot of people's experience. In many cases, they're too late, right? Before you book your flight from wherever, who knows what could have happened. And I'm saying this from a very real place. As recently as 2 weeks ago, I got a call from somebody who is, again, abroad trying to get an ambulance for a family member in Nigeria. So, our natural disposition as people when there's an emergency is to call somebody that we know. And it does not often matter whether that person is physically able to come to your aid or not. Ideally, yes. But sometimes people will call their child who is in the US before they think of calling a local provider to help. And a big part of that is rooted in a lack of awareness and a lack of education, what I would sum up as a lack of preparedness. So for me, when I see a plan with Fleri or a plan, an Emergency Response Africa plan through Fleri, it's really about preparedness and it's really about choosing a better alternative. So rather than going through all of that I've just described, a plan through Fleri essentially means that first of all, you know what's covered, right? You know that you have access to that pre-hospital care. You know that if there's an emergency, and we'll talk to you about the different types of emergencies. You can even go as far as to take a first aid training course, if only for the purpose of recognizing emergencies. That in itself is valuable. So you'll know all that, you'll be able to do all that. But most importantly, you don't then have to think about how am I going to, book my own ticket and how can I rush over there. You may still need to go, right? But at least you can go with a measure of confidence and peace that people who genuinely care about the outcome of your loved one's life are already on the case. And I think that's for me what it's about. It's really just a question of, do I want the alternative of something happening and I'm panicking and now I'm trying to frantically find a solution? Or I get this plan, I educate the appropriate beneficiaries. They know what they can do when something like this arises. It doesn't even have to come back to me immediately. I find out that, oh, so and so happened, oh, but we took care of it and everything was done, everything was sorted. There's nothing like that, certainly compared to the alternative. So I think that's really what the plan is. It's about preparedness and certainly that peace of mind.
Yeah, that's a really good way to put it because the alternative is certainly not any better
Mhm.
than that. I want to be able to jump in and actually walk you through, or have you walk us through, um, what the component of emergency response plan on Fleri is, for people to understand what they have access to, what their loved ones would have access to in that way. I think it's really important to be able to visualize it in a way that makes it a bit real for folks. So, I skipped a couple of pages as we get in, but essentially, if you land on Fleri and you have relatives that live in Nigeria, what's going to happen is you would have, the ability to select between the categories of care that you're looking at. Fleri carries, everything from partners who provide comprehensive care. So think of your, insurance providers, telehealth providers, at-home care, and then other options there. Interestingly enough, ERA also has a travel emergency product, right, that we carry as well. So we'll start with the two here. emergency proof and ready. Let me know when you're ready to walk through it.
Sure, sure. So I mean, I think I don't know if I can talk through it as you go, but maybe what I'll do is I'll give a general overview. So if you want, you can like scroll along and all of that.
Okay.
And I would encourage people to definitely go and check. But I'll just talk through what the emergency plans offer you, and then kind of the core difference between the ready plan and the proof plan.
Mm-hmm.
So what these plans essentially offer is access to emergency response care. And what that covers, like I've said before, is the 24/7, 365 care, right? So whether we're talking holidays, in the middle of the night, any time of day or night, election period, it really doesn't matter what's going on. We are always working. So it's about that 24/7 access and peace of mind. So that's number one. The second piece is then the treatment that happens. And I already described kind of the three tiers that we offer, right? So the first tier is what we call the phone-based first aid, the basic instructions that anybody can follow to begin to support and help whoever is, in the emergency situation, even while help is on the way. The second level is, of course, the first responders being dispatched, and that really depends on the circumstances of the case. So if we determine that it's a relatively minor case, or it's a case that could benefit with having a first responder on site initially, we'll send out a first responder. And then the third phase, or the third level, is of course the ambulance dispatch, where we're actually sending out a fully equipped ambulance along with a medic and a driver to come, assess, pick up, treat, and transport the patient to a hospital. Now, whenever we send out a first responder or an ambulance, that's what we call a call out. It
Mm-hmm.
basically means that we have left a base or a location to come to you wherever you are, right?
Yeah.
So that's key. Once, of course, the person has been picked up on site, we will then convey you to a hospital. Now, sometimes that can be a bit tricky because we always get questions from people like, can you take me to my own hospital, or do you have to take me to one of your own hospitals? And we always like to share that flexibility is key for us. So, as much as we would like to take you to a hospital within our network, because those are the hospitals that we have had go through an assessment process, and we have, in a sense, verified them as emergency ready, and we know what they can and cannot do. We
Mm-hmm.
also recognize that there are many circumstances under which that is not possible. It could be simply that the patient has a preference for where they go to, or there's a particular place maybe they've already been treated before, and so there's a history where there's a doctor that knows all their background and all of that, and it makes sense to take them there. Or it could just be a proximity thing. Rather than taking them all the way somewhere that's a bit far, we can take them somewhere closer. So that's something that really does get determined on a case by case basis. But the biggest consideration is what is in the best interest of the patient. And what we do is then we convey the patient over to that hospital. We communicate as much as possible in advance, and then we hand over the patient to the hospital. Now, in a situation where a patient has an insurance plan,
Yeah.
right? So maybe they already have an insurance plan through Fleri already. That's something that we would be aware of through our onboarding process, and it just makes it a little bit more seamless when you're handing a patient over in hospitals to say, oh, actually they are a beneficiary of so and so plan, and the hospital can do the necessary work to take them in and begin that treatment. So both emergency plans actually offer you access to that. The core difference is that while the proof plan builds in the ambulance response, the ready plan does not. So the ready
Uh,
plan is almost like a really sort of basic, you want to know that, these people are there for you, if you call. But the difference is that there will be an additional payment if we actually have to dispatch a responder or an ambulance. Essentially, if we have to make a call out. So you're
yeah.
basically paying for the right or the priority, if you will, to
Mm-hmm.
access the service. Now, obviously, we always like to recommend the proof plan because then we're not even talking about you then having to pay extra
Yeah.
for the pre-hospital care. And I
Yeah.
think that's the big thing. I want to also maybe talk about what are some of the types of cases, right, that we see and deal with. Accidents and injuries are a big one, right? So whether that's a road accident or maybe it's a home-based injury, again, we talked a little bit about elderly people. So somebody who is maybe still, kind of independent, but obviously still needs support, and maybe they burn themselves while cooking. That's an example of a situation where an emergency response could be helpful, obviously to get to the scene, to provide treatment then and there, but also to convey them to hospital if needed. Sudden cardiac arrest or a heart attack, I mean, enough said. If that happens, you need some advanced hospital care.
Yeah.
One of the things that I always like to share is we always travel, whether it's our motorcycle medic or our ambulance, we will always travel with a defibrillator. And what that means is that we can actually administer and resuscitate people at the scene even before getting to hospital. That's not a device that many people have access to, unfortunately. So it's definitely a big benefit. And then, of course, other things, stroke, breathing difficulties, any type of loss of consciousness, seizures, severe bleeding, pain, so severe pain, pregnancy related emergencies, and several others. Those are the types of cases. I even mentioned like mental health cases as well. Those are the types of things that we deal with. And I think the big thing just to note is it's really about that peace of mind, right? It's the preparedness. So that's what those plans offer.
Yeah, that's a really, really good point. I wanted to be able to touch on this because, you know, people obviously ask, and this proof plan. So you're saying, I'll just like, oh, you're saying, so when I buy it, what do I get on a monthly basis? Are they coming to my house every month? Do you want your parents to have an emergency every month? No. Oh, no, of course not. But I want to know, like, well,
Yeah.
and you touched on something really interesting here. A lot of us, again, and that's why we started with the preconceived notions that we need to disabuse ourselves of. A lot of us think that an emergency is when you have a car accident or someone passes out. An emergency is when, your mom is starting to talk funny. She's having trouble breathing, right? And I wanted to ask this for a lot of the people that had asked. When you get the proof plan, is there a limit to the number of times you can reach out to ERA for an emergency?
Yeah, good question. So there is no limit to the number of times you can reach out to us. And I'll be very clear on what that means. It
Mhm.
means that we want to hear from you. If in doubt, call, right? Like, even if you're not sure if this constitutes an emergency, that's fine. Call, we will triage and we will advise accordingly.
Yeah,
There are a proportion of cases that we receive that we don't ever do a call out for, and it's simply because it's not an emergency situation that requires a response. It may
yeah,
require urgent care, right, which we can advise, like, hey, you know what, go to your doctor. I mean, if you call and you tell me you have a severe headache, like, I get headaches and I don't like them. They're not fun, but they're also not life threatening, not as a standalone. Now, maybe in the context of other things, perhaps, and that's where triage comes in. So there's no limit to the number of times that you
yeah. I think we'll give Falaka a second to get back in. So while she waits to get back in, we can go through the plans for a bit. The biggest part about having ERA is the peace of mind that comes in. If you look at the pricing itself, it's about $200 a year to know that your family back home has this 911 style service that they can always plug into and reach out to if they have any kind of emergency. And that's the best part about, being able to have this access, regardless of where they are, in Nigeria. Hello, welcome back.
Hi, yeah, sorry. It seems my internet went off and then I got a guest. So
We're glad Canada is learning from NEPA.
no, not quite that.
Yeah. So you were talking about the number of times that folks could reach out to ERA on the proof plan.
Yes, so I was saying that there's no limit to the number of times people can reach out to us. Where the limits apply will be on the number of call outs that
Okay.
they can receive. So if I remember correctly, call outs are on a quarterly basis. I believe there's 1 or 2 call outs per quarter that are permitted. And that's where the limits apply. So you can call us as many times as you like, any day, anytime, and there's no, in quote, cost or limit attached to that. But we will always triage and then provide the appropriate response. And if the response is a call out, and then you get to a point where you've actually exceeded the allowed call outs on your plan, then of course there will be an additional charge for you to continue to access the service. So it does not stop you from being able to access the service even if you exceed the plans. But what it just means is that we would then need to charge you a separate, like, one-off fee to cover those.
Okay. Okay. Sounds great. Sounds great. Really appreciate you walking us through this. And I know I've taken up, yeah, I can see a little girl there.
Yeah.
But yes, Folake, it's been such a pleasure going through, the work that you're doing, the inspiration that you are, as well as the impact that you're going to have. Thank you so much for joining us. It's
Thank
been
you,
a
Sam.
pleasure. I'm looking forward to this going out, looking forward to more people being able to learn about the work that ERA is doing.
Same here. I really, really appreciate you having me on. Hopefully, those that have tuned in have learned something. I'm certainly looking to see some of those plans flowing in. But please don't hesitate to reach out to us if you have any questions about our services. Thank you so much, Sam.
All right, saving lives and raising children. That's amazing. Thank you.
Thank you. Take
Uh,
care.
you too.
Bye.